Being diagnosed with kidney disease can be very scary. Education is really the foundation of empowering a patient. A patient needs to understand their chronic kidney disease, and most often, if you go to a doctor's office, they may spend a little bit of time with you, but there's someone in the waiting room next door, and so they might not have the time to spend educating a patient. And we have that time. We can spend the time talking with the patient on the telephone. We can sit with them in the physician's office. We can mail them materials and then call them a week or two later and say, hey, what did you think about that? Education about their kidney disease is the foundation for allowing them to understand their disease better and also delay progression of their disease. We also have predictive analytics that identify a patient's risk of progression to ESKD or dialysis. A couple things that I think are special about Interwell Health's model are the diversity of our clinicians. So we don't only just have a nurse that cares for the patient, we have nurses, social workers, dietitians, pharmacists. So whatever the patient's needs are, we can provide the correct clinician to provide for those services. One of the things that makes Interwell Health special in our approach to kidney disease and kidney disease management is that we put both the patient and the nephrologist really at the center of the care model. We collaborate with the nephrologist. We're either in their office working with them or working with them telephonically or virtually to make sure that we are working step by step with them on what their preference is for the patient's care and the patient's needs. We are not only the experts in kidney care, but we're the experts in providing holistic care for the patients that also affects their kidneys. We can provide a healthier patient, a better quality of life patient, which also will then lower the cost of care.